yung mga dizziness ng patient. So, of course, we will just let our patient rest. Okay? Give time for your patient to rest para ma-relax din yung kanilang katawan at isipan para, di ba, mas maging effective ang treatment natin. Okay? And then eat foods that are rich in vitamin B12 to prevent deficiencies such as a result of drug therapy. Ano ba yung mga vitamin B12 or what is your vitamin B12? Your vitamin B12 is your cobalamin. Okay? And cobalamin or vitamin B12 is rich in foods such as your fish, your meats, your eggs, the cheese, mga dairy products natin. Okay? So, yun yung ating vitamin B12. Okay. Another kind of drug is your anticholinergic agents. Okay? So, your anticholinergic agents, these are also known as your antispasmodic. Okay? Your antispasmodic, class 3 o'clock ko na kayo i-break ha. Tapusin nyo lang ako. At least meron pa tayong 5 minutes. Okay? Before I will give you your break. Okay? So, patapos lang ito. Your anticholinergic or your antispasmodic agents, these are usually drugs that block the action of your acetylcholine. And we know that your acetylcholine, that is your potent neurotransmitter. Okay, or this is your chemical messenger. So what they do, or what does anticholinergic do? They are going to inhibit, okay, the action of your parasympathetic nerve impulses. Okay? So, ano yung tawag nito? Ginagawa nila, they are going to reduce gastric acid secretion. Kasi nga, the nerve impulses that this PNS is doing, okay, this includes the activation of your mga involuntary muscles. Involuntary muscles ninyo, like your respiratory, mga cardiovascular, including your GIT. Okay? So, it reduces gastric acid secretion, decreases smooth muscle motility, and delays gastric emptying over time. Okay? So, if you're going to block, okay, if you're going to block the acetylcholine, okay, anong nangyayari ngayon? There will be involuntary muscle movements, okay? Digestion tends to become slower, and there will be mucus secretion. Okay? Mucus secretion will be decreased, or yung mas maghina ang production. Okay? And then, what are the uses of your anticholinergic agents? These are adjunct therapy. When we say of adjunct therapy, this is a supplementary treatment. For what? For PUD. Again, your PUD or peptic ulcer disease is the etiology bakit nagkakaroon tayo ng hyperacidity. But your anticholinergic, antacids, and H2 receptor blockers, they do not treat, okay, the etiology. They only alleviate, okay, or they only give relief or soothe the symptoms that your patient is feeling. Okay? They are also used for spasms and cramping associated with irritable bowel syndromes. Okay? So what are the examples now of your tawag nito, antispasmodic or anticholinergic agents? These are your atropine sulfate. Ma'am, di ba ang atropine sulfate emergency drug? Yes, daghan kayo siya beneficial effect. Okay, your belladonna alkaloids, which are your phenobarbitals, and your hyoscine sulfate. Okay, ito yung mga examples ng mga gamot na yan. Okay, what are the contraindications and the cautions that you have to take note for taking anticholinergic agents? Okay, allergy to any component of the drug, because it is to prevent any forms of hypersensitivity reaction. Okay, basi instead maayo imong patient, basi madayunan imuhang patient. Okay? Patients who have glaucoma, because nga naman, if you're going to give anticholinergic to patients who have, abi na kung naunsa na diri, abi na kung kwaon ako sa langit, charot. Hayag kaayo, okay? Tawagani ka ng, if there is, okay, kanang glaucoma in a patient and they are taking anticholinergic or antispasmodic, okay, they tend to exacerbate, okay, the blockage of your PNS. Okay? There is also people also who have intestinal atony, paralytic ileus or GI obstruction should not be given with your or should be taken into consideration before administering your anticholinergic drugs because they can tawag ani exacerbate for further slowing, okay, further slowing of your GI activity. So unsay mahitabo sa imuhang patient ani, wala na magkaroon og obstruction sa moot ang imuhang patient kay nag-take na gani siya og anticholinergic na niya naa pa siya mga pre-existing intestinal problems. So wala na gyud motility sa GIT sa imuhang patient. Okay, grabe na gyud na ka discomfort sa imong patient. And it should be contraindicated to patients who are pregnant. Kasi nga, this could have adverse effects on the fetus. Okay? So, what are now the adverse effects of anticholinergic drug? CNS, it may patient may have blurred vision, pupil dilatation, photophobia, increase in IOL or intraocular pressure. Kaya nga, contraindicated siya sa mga patients who have glaucoma. Okay? There could be weakness, dizziness, as well as insomnia. For cardiovascular, patients may tend to have tachycardia and palpitations. For GIT, mas magkaroon pa ng dry mouth, altered ang taste perception, nausea, heartburn, as well as constipation. And for the genitourinary is magkakaroon ng patient mo ng urinary hesitancy and tawag nito urine retention. Okay, so these are the adverse effects now of your anticholinergic drugs. Okay, so I will give you a break. Okay, I will give you 15 minutes break. And then at 3:15, okay, at 3:15 we will start again our class. Okay, you may take your break now. Okay, class. So we continue. Ayan, lampas na. Okay. So what are the drug interactions now if you're going to administer mga anticholinergic medications? So we are not allowed to combine antihistamines or antiparkinsonism or anti-Parkinson's drug, including your MAWIs and your TCAs. What are your TCAs? This is your tricyclic antidepressant medication to what? To your anticholinergic. Bakit, ma'am? Kasi if you're going to combine these drugs together with your anticholinergic, mas umi-increase ang tawag nito, ang incidence of anticholinergic effects. Ano ba yun? 'Di ba? Yung nagkakaroon ng severe dry mouth ang yung patient, nagkakaroon ng constipation, nagkakaroon ng blurry visions, pwede rin magkaroon ng urinary retention ang iyong patient, mag-increase ang heart rate, as well as there will be decrease in sweating. Kasi nga, there is retention, fluid retention ngayon. Kapag i-combine mo ang iyong anticholinergic drugs together with this 4 medications. Okay? What about if you combine it with your phenothiazines? Nagiging less effective ang phenothiazine kapag i-combine mo siya with your anticholinergic drugs. And itong mga burdock, rosemary, and turmeric, ma'am, dili man siya tambal, ma'am. Okay? This is not a drug that is kanang tawagan kanang medically drugs, but these are what do you call this? Uy, kanang mga kanang mga organic meds ba? Or kanang mga natural meds. Okay, sandali. Ma'am, okay lang po if paulit po ano mangyari if mag-react. Okay. Nagkakaroon tayo ng tawag nito, yung dry mouth, severe dry mouth, constipation, blurry vision, urinary retention, okay, increase in heart rate, and decreased sweating. If you are going to combine antihistamine with your etong antihistamine, your anticholinergic drug with your antihistamine, anti-Parkinson's drug, MAWIs, and TCAs. Okay, sige. So, pag phenothiazine, nagiging less effective siya if combined with your anticholinergic drug. With your burdock, rosemary, and turmeric, mga organic drugs ito or yung mga herbal drugs. Okay, herbal drugs. So, pwede ma-exacerbate, okay, ang anticholinergic na effects. Mas magkakaroon, same siya nitong sa mga antihistamine natin. Pwede siya magkaroon ng mga severe dry mouth, constipation, if you're going to give your anticholinergic drugs with this kind of mga herbal drugs or mga organic medicines. Okay? So what are your nursing responsibilities now if you're going to administer anticholinergic drugs? So first, okay, above all, you always have to establish a baseline physical assessment. Okay, in order for you to monitor if there is what effectiveness or if there is adverse or potential adverse reaction to your patient after taking the drug therapy. Okay? Kaya bitaw, 'di ba? It's always reiterated or given emphasis for us that before we do any procedure or anything to our patient, we always or we must have a baseline info and baseline physical assessment on your patient. Okay? You also have to assess the abdomen of your patient. Bakit man, ma'am? That is to evaluate the gastrointestinal and urinary na mga effects. Kasi nga, di ba, pwede magkaroon ng fluid retention ang iyong patient. So, kung may fluid retention ang iyong patient, pwede magkaroon yan ng anasarca or pwede magkaroon ng edema kung saan mang parts all over the body. Okay? Okay. You also have to monitor your bowel elimination. It's just the same with your abdominal assessment. Okay? You have to take your anticholinergics before meals para mas maging mabilis ang absorption ng drugs sa ating GIT. Okay? And if you're going to combine antacids, give your antacids 2 hours after your anticholinergic medication. Okay? And assess your patient for any signs of contraindications or cautions. Okay? Like yung mga, maliban pa doon sa mga tawag nito, yung mga drug interactions, tingnan natin yung mga possible na pwede maging effect nito sa ating patient. Katulad ng mga adverse reactions nila. Okay? So your proton pump inhibitor. Okay? Bakit siya tinawag na proton pump? Okay? Ano bang ginagawa nila? Your proton pump inhibitors, that's why they are called like this because they are going to block or they are going to inhibit the chemical system of your what we call hydrogen potassium adenosine triphosphate enzyme system or your hydrogen or etong hydrogen potassium ATPase enzyme. Okay? This hydrogen potassium ATP, okay, ATPase is also known as your proton pump. Okay? And then they are found in the cells of your stomach lining, which is also essential in the production of hydrochloric acid. Okay? Maliban pa sa parietal cells natin, these are also needed. Okay? Yung ating ATPase na system. Okay? Your proton pumps are 90% more effective than your H2 receptor blockers. Okay? Kaya mas maganda yung effect nito or mas common ito binibigay. Anong example nito? Proton pump, itong mga Prilosec, Zantac, Nexium, Prevacid. Ito yung mga examples ng ating brand examples ng ating mga proton pump. Okay? Meron din tayo yung mga omeprazole, mga ganyan. Okay? So, ano ang ginagawa ng ating mga proton pump? They help prevent, okay? They help prevent now your ulcers or they also help in healing, okay, your ulcers. Okay? By what? By decreasing the amount of your acid production in the stomach and yung tendencies of having GERD, okay, as symptoms of your heartburn. Yun ang ginagawa ng ating proton pump inhibitors. So, maliban dito, what are the examples, the generic names of your proton pump? We have your omeprazole. Okay, pinaka-common, omeprazole, omepron, or Losec. Okay, those are the brand names of your omeprazole. Your pantoprazole, your esomeprazole, and your lansoprazole. These are now the examples of your proton pump inhibitors. Okay, so what are they used for? Okay, they are used for the treatment of stomach ulcers, including duodenal ulcers. They reduce acid refluxes, which may cause heartburn or inflammation of your gullet. Plus, the other name of your esophagus is your gullet or gullet. Muna siya. Or esophagitis or the inflammation of the esophagus. Okay? It is also a one-part treatment to get rid or to eliminate H. pylori that causes your tawag niyan, ulcers. Okay? It also prevents and treats ulcers associated with anti-inflammatory medications or your NSAIDs. Okay, mas wider ang tawag nito, no, ang coverage ng ating proton pump compared sa ating mga H2 receptors at saka yung ating mga antacid. Okay, and in rare conditions, okay, it is also used to help treat mga Zollinger-Ellison syndrome. Ano itong Zollinger-Ellison syndrome? Okay, this is a very rare condition